Hi, I'm Dr. Jim Pritchett. I'm at my office here in downtown Seattle, and talking today about hip replacement surgery. Uh, Basically, a high demand type, different way of doing hip replacement, and there are many ways we can do it. A typical hip replacement I'm showing right here. This is a pretty standard type hip replacement. It's got a stem that goes in your femur, the replacement ball itself, and that's a pretty standard type ball. 90% of Americans would have had a hip replacement just like that last year. A good way to go, a common, straightforward operation. In fact, hip replacement was declared operation of the century. Admittedly, that was the last century, but it's still holding up well this century too. The socket piece looks kind of like that, and the socket diameter would be a matching to the ball, and put these in, people can use them pretty darn well. Limitations have been a few things. The ball being smaller than your natural ball, there's always a sense, would it feel like your normal hip and is stable? For most people, it works perfectly fine. 2/3 of patients that come to any orthopedic surgeon with a bad hip are older, and they can get by with some limitations. And then we have some younger patients, which in my practice is most of the people coming in who don't want any limitations. And they might be asking for a hip that will do just anything. They could be a circus performer, an acrobat, Pilates instructor, yoga instructor, athlete of any type or description, and they ask me, can you fix my hip in a way that I have no limitations whatsoever? And that's for sports. We call those adventure sports. They're sports that are beyond what most people do, but they're what some people want to do. The other limitation has been sexual function. That's been underestimated in our literature, but now there's information coming out. Questions are being asked. This subject, which in the past wasn't discussed much, is. When it came up, we found that 40 to 75% of our patients were limited in sexual activity from the hip problem they had, and a good many still were as far as position they could assume. Mostly the women, it turns out, but some men too, because different positions have to feel stable and confident and pain-free to function well for you sexually. So 4 questions are commonly asked. Is there a limitation? Does it limit what you do? Is there any pain involved? Does it limit the frequency of sexual activity? And we ask those questions before and after the operation now. Turns out that a hip of the standard type would still often have limitations. There might be less than before, but there would still be some. There are other designs you can use to get around that. This would be an example of a hip. And all I've done, all you can see here is that the ball, it's bigger. It's half again to in some instances even twice as big, depending on how big the natural hip was. And then the ball is a double ball instead of a single. So that's a difference. This type of hip, and again it would fit into the socket. This, by the simple measure of making a double ball from a single, will then allow the hip to assume any position that you want, any position at all. You don't have to limit it whatsoever. It can accommodate it. And the way it can do that is it has 2 places to move. The ball moves against the socket, and one ball moves on the other. So that those 2, rather than just one freedom area for movement, will allow the stability of the hip and its range of motion to both increase. So we've been offering this hip in certain selected circumstances, typically a young person who needs a large range of motion, or someone whose stability has been compromised from some other way. They might have had a congenital abnormality where the shape of their hip leads to some lack of confidence. And when we looked at doing this, we found out it works virtually every time. Drawback of using it, however, is you have to plan it, assemble it, and you have to, in your mind's eye, and often with x-ray help, match the dimensions of your patient. If you're going to get it to work exactly right so their brain and muscles will drive it in all the correct directions so it works perfectly, it's a very demanding operation. And the implants require a little bit of intraoperative assembly, and they're a little bit more expensive. So it's not hip replacement I think will take over for everybody all the time, but it has some advantages. And the recent paper that we published on this was called a tripolar hip replacement or biarticulated hip replacement that's useful for unlimited sexual activity, and adventure sports are possible with it.